Hello and welcome to our Health Hour podcast. I am your host, Ashley Camato, and joining me today is our guest, Miss Anjanette Lizo and Mr. Gamilla. Today, we will be talking about viruses, cancer, antiviral agent, and antineoplastic. They are going to discuss some of the most common myths and facts surrounding cancer and viruses and its treatment.
All right, so to begin with, let's talk about viruses. So viruses are tiny infectious agents that can cause a range of illnesses, from the common colds to more severe disease such as HIV, AIDS, influenza, and COVID-19. These viruses can be difficult to treat because they are not alive in the traditional sense and they are rely on host cell to replicate. Fortunately, there are antiviral agents available to help combat this disease. Antiviral agents are the type of drugs that specifically targets viruses and works by preventing the replications within host cell. Some of the most common antiviral agents include acyclovir for herpes and oseltamivir for influenza and remdesivir for COVID-19.
Okay, so let's start with the basics. What exactly are viruses?
Well, viruses are infectious agents, like what I said earlier, that can only replicate inside living cells, and they are very small and cannot be seen with a regular microscope.
Bakla to eh.
Interesting. So, and
Oo.
how do viruses work?
Well, when a virus infects a cells, it hijacks the cell's machinery and uses it to replicate itself. And this process can be damages the infected cells, leading to disease.
Oh, that sounds scary. But I heard that there are antiviral agents that can help fight viruses. So, can you tell us more about them?
Yes, of course. Antiviral agents are medication that can target specific viruses and prevent them from replicating. And these are several different types of antiviral agents, including the protease inhibitor and neuraminidase inhibitor. And lastly, we have the nucleoside analogs.
Wow, and that's a lot of technical terms. So, can you explain what each of them does?
Oh, right. Okay. Um, Nucleoside analogs, ito yung drugs that mimic the structures of nucleosides, which are the building blocks of DNA and RNA. By doing so, they can interfere with the replication of the virus. While the protease inhibitor, so in other hand, this is the target specific enzyme that are required for the virus to replicate. By inhibiting these enzymes, and the virus cannot replicate and infection will be stopped. Lastly, we have the neuraminidase inhibitor. So these are the type of antiviral agent that targets the neuraminidase enzyme, which is essential for virus to spread from one cell to another.
Oh, that's fascinating. So, are there any specific antiviral agents that are effective against COVID-19?
Of course, yes. There are several antiviral agents that can have shown or promising result against COVID-19, like remdesivir is an antiviral
Bakit?
agent that has been approved by FDA, right, for emergency use in
Verances na ba ta?
COVID-19 patients.
Tingnan mo na.
And other drug called um, favipiravir. Have you heard that? Also known some positive results in clinical trials.
Oh, thank you so much for sharing that information with us. So, is there anything else what we can do to protect ourselves from viruses?
Yes. There are several precautions that we can take to protect ourselves from viruses, like washing our hands regularly, wearing masks in public, avoiding crowded places, and getting vaccinated, of course.
Okay, so now let's turn our attention to cancer. I know that cancer is a complex disease characterized by the uncontrolled growth and spread of abnormal cells in the body. So there are many different types of cancer and treatment. And treatment options can vary depending on the location and severity of the disease. So, can you tell us some more about cancer?
Yes, exactly. One of the main challenges in treating cancer is the cancer cells are often able to evade the body immune system, right? And become resistant to conventional therapy such as chemotherapy and radiations. And this is where antineoplastic agents come in. And neoplastic agents are drugs that specifically target cancers cells and work interfering with their ability to divide and grow.
Okay, so now let's talk about the myths and the facts about cancer and viruses and their treatment. Okay, Jeff?
Oh, hi. Now let's talk about the myths and facts about cancer. So let's start. Um, the first myth is cancer is always fatal fact. While cancer can be serious and life-threatening disease, it is not always fatal. Advances in cancer treatments have led to improved survival rates and quality of life for many people with cancer. Early detection and treatment are critical in improving outcomes. So another myth is antineoplastic always cause hair loss. Um, Hair loss is a common side effect of some chemotherapy drugs, but not always antineoplastics cause hair loss. Some newer drugs, such as targeted therapies and immunotherapies, are less likely to cause hair loss than traditional chemotherapy drugs. Next is chemotherapy kills all rapidly dividing cells, including healthy ones. So, while chemotherapy does target rapidly dividing cells, such as cancer cells, it is also affecting healthy cells in the body. However, healthy cells can usually repair themselves more effectively than our cells, which makes them less vulnerable to damage from chemotherapy. So, another myth is natural remedies can cure cancer. Well, in fact, while some natural remedies may provide relief from cancer symptoms to help improve quality of life, there is no scientific evidence to support the claim that they can cure cancer. So we have to remember that it's always important to talk to your doctor before trying any alternative therapies or supplements, as they may always interact with cancer treatment or cause harmful side effects. So another myth that we can have is if you have a family history of cancer, you will definitely get it. Well, in fact, having a family history of cancer may increase your risk of developing the disease, but it does not mean that you will definitely get it. Many factors such as our lifestyle, environmental exposures, and also influence the risk of cancer. So nasa sa kamay talaga natin kung paano tayo mabuhay, yung lifestyle natin nakakaapekto sa pag-develop ng cancer cells natin.
That is correct.
Yes. Another myth is cancer treatment always cause severe side effects. So the fact is, while cancer treatment can cause side effects, not all treatment cause severe side effects. Advances in cancer treatment have led to the development of newer drugs and therapies that are less likely to cause severe side effects than traditional chemotherapy. Additionally, there are many ways to manage and prevent side effects, such as anti-nausea medication and supportive care. Okay, this is just a myth um, na pwede nating na napag-usapan natin para sa podcast na ito. So, yun.
Well, thank you so much for that long and overloading information about the myth and facts about
Yeah,
cancer.
always welcome.
So now let's go to the myths and facts surrounding antiviral agents. So one common myth is that antibiotics can treat this viruses. So Miss Lizo, can you tell us if this is true or false?
Well, I think let me answer this one.
Oh, okay.
Go.
I believe that is false because antibiotics are designed to kill bacteria, not viruses. In fact, taking antibiotics um, is when you have a viral infection can be harmful as it can lead to antibiotic resistance and other complications.
Oh, that's good to
Would you agree,
know.
Miss Lisa?
Yes, I agree with that.
Thank you.
Oh, that's good to know. And thank you for that, Chef. And another myth that's been circulating is that vitamin C or other supplement can prevent or cure a viral infection. Is there any truth to this?
While it's important to have a healthy immune system, I think that there is no scientific evidence that taking high doses of vitamin C or other supplements can prevent or cure viral infections. The best way to protect yourself is through good hygiene practices like washing your hands frequently and avoiding close contact with sick individuals. So parang
Yeah,
this only means that vitamin C helps us to improve our immune system. So pagka na-expose tayo sa mga taong may sakit, hindi tayo mabilis mahawa.
Okay, that's
true.
a great reminder. Another myth that has come up during the COVID-19 pandemic is that wearing a mask can make you sick or decrease your oxygen levels. So, may I know what your thoughts about this?
So, ang ano dito false because masks do not decrease your oxygen level or ini-increase yung carbon dioxide level mo. In fact, masks are effective way to prevent the spread of COVID-19, right? Kaya nga na-invent yan eh, and other viral infections. And it is important to wear mask properly, covering your nose, mouth, avoiding touching it frequently. Yun.
Oh, thank you so much for clarifying that. And now let's talk about antiviral agents. Are they effective in treating viral infections, Jeff? Jeff?
I
Oh, I'm so
think
sorry.
Jeff left the group, huh?
Oh,
So
I heard.
I will answer that.
Oh,
Yes, antiviral agents can be effective in treating certain viral infections, but it is depends on the virus and severity of the infections. Antiviral medication work by targeting specific parts of the virus life cycle, such as replication, like what I've said earlier, and in entry into the host cell. And some of example of antiviral agents include acyclovir for herpes infection and oseltamivir for influenza.
well, thank you
Yun.
so much for that, Anne. So, since Jeff already left the meeting because I know he actually has some errands to do, and I know that Anne is a very good student and
Oh,
very
yeah.
knowledgeable one. So let me take this moment and ask you more questions. So
All right. Go
are
ahead.
there any so Anne, are there any side effects associated with taking antiviral medications?
Yeah, like any medication, antiviral agent again can have side effect, but they are generally tolerated. And common side effects includes, alam mo naman, yung nausea, vomiting, ayan, magkakasama yan, and diarrhea.
Right.
However, it's important to speak with your healthcare provider about any concern you have before taking any medication. Yun naman talaga yung importante when it comes in medication and health.
Yeah. Very important to
And
consult your doctor
yeah,
talaga. No?
additionally, some of common antineoplastic agents include cisplatin. Have you heard that? For testicular and ovarian cancer yon. And paclitaxel for breast and ovarian cancer. And um, what we call this one? Amatinib for chronic myeloleukemia.
Okay, thank you so much for that. So, well, this
Parang ang
drug,
talino ko ata sa part na yun.
oo, kasi I know that ano na, you're graduating na, so actually you're always preparing na. And so ayan yan. So while these drugs can be effective in treating cancer, so they often come with side effects such as nausea, vomiting, and hair loss, right?
Yes, magkakasama ngayon, di ba sabi ko? And that is why it is important for patient to work closely with their healthcare providers to manage these side effects and ensure the best possible outcome.
So thank you so much for that information. And before we wrap up, do you have any final thoughts or advice to our listeners? So
Yes.
this is your chance.
Of course, I have. So I would like to emphasize the importance of good hygiene practices in preventing the spread of viral infections. This includes again and again washing your hands frequently, avoiding close contact with the sick individuals, talagang iiwas ka doon, and wearing masks in the public settings. And it is also important to speak with your healthcare providers if you think you have a viral infections, as they can provide guidance on the best course of treatment.
Thank you so
Ayun.
much. Yeah, I think it's time to wrap up now. So thank you for joining us today, Ms.
Thank
Lizo,
you,
and
Din.
also to Mr. Gamilla, and for
Yeah.
sharing your knowledge on virus, cancer, antineoplastic, and antiviral agents. So that's all the time that we have for today's episode. And thank you for tuning in. We hope you
Yeah,
learned something new today. Thank you so much, listeners.
And thank you.